Welcome back, all. It's been amazing to have yet another superpower to come in here and tell us what they've got. And as usual, I'm going to introduce the moderator, going to be Richmond, and then Richmond can introduce the rest of the panelists, and then we can get going. So today, the last panel for today's conference is going to be on the resilience of African people. We're going to be looking at what the world can actually learn and the ways. So the person who's going to be moderating this is Richmond, and then Richmond will be able to introduce the rest of the panel. I'm excited for this panel, really, looking at the caliber of people we've brought together to have this very important and key conversation going forward. So Richmond, over to you.
Well, thank you very much. I hope I'm on mute and my camera is on. All right. Thank you, David, for that introduction. And thank you to all the panel members for joining this session, which is going to focus on resilience of African cities, what the world can learn and ways forward. This session has been deliberately structured in such a way that we are going to speak around four main themes. The first one has to do with COVID-19, obviously, is a big issue that we are currently grappling with globally. So we want to see how the African cities are engaging with COVID-19. What are we doing right? Are there any success stories, anything that African cities have done that we can celebrate, we can learn from, and we can encourage? We will then also move on to talk about issues regarding urbanization. And I believe other sessions have highlighted what urbanization holds and currently the demographic changes that is happening in Africa and the challenges as well as opportunities that urbanization presents us. Then we will now move on to also discuss issues around climate change, which it's both a concern for most people, and particularly for Africa, given what is happening in some African countries. So we'll pick thoughts and stories and insights regarding climate change. Then we will wrap it up with issues regarding digitalization, which is something that all of us find ourselves in. So that is how the conversation. So each of the panel members will speak to each of these four themes, and so that we'll be able to sort of pick each one's thoughts on these questions. I would like to begin by sharing a thought that was shared by Professor Ida Lindell, an associate professor in the Nordic African Institute, regarding African cities. And he writes that cities in Africa are not only growing rapidly, but are also undertaking deep political, economic, and social transformation. They are changing in ways that defy usual notions of urbanism. In their dazzling complexity, they challenge most theories of the urban. African cities represent major challenges as well as opportunities. Both need to be understood and addressed if a sustainable urban future is to be achieved on the continent. On the back of this, I would like to begin with the first question around COVID-19. Indeed, in Africa and across the world, cities have become the epicenters of the COVID-19 pandemic, leaving some academics to even describe the pandemic as a city's pandemic. So the question is, in what ways have African cities shown resilience in the different phases of the pandemic, including the imposition and lifting of lockdowns and the ongoing vaccination efforts? What has been the impact of the pandemic, and how has it impacted economic and other social activities in our cities? And I would like to begin with Dr. Taibat, because you have recently written a commentary with your colleagues on how the built environment is being impacted in terms of physical leisure activities. So I would like to pick your thoughts on this particular topic.
All right, thank you very much, and hello everyone. Yes, you said rightly that the pandemic is essentially a cities-based one. And I must say that in the city that I'm in, Lagos, arguably the largest African city, but definitely one of the most complex to govern. A city of over 21 million people. Things changed very rapidly. And because we had the experience of Ebola in 2014, our government, our state government, was able to rise to the occasion of initial responses. So take, for example, we had the protocols as early as January. The pandemic was announced, in December. And by January, there were protocols around contact tracing, around, people moving in and out and about, and, there was information upload. Unfortunately, the challenge was that the information was targeted at the educated elite, and so many were left behind. So along the line, we had issues of people denying, the lockdown, or denying the pandemic, as it were. But then again, because Lagosians are resilient people who were able to navigate, there were quite a number of unfortunate incidents when the lockdown was initially announced, but people rose to the occasion. People were able to rejig their lives. And one positive thing that often goes undocumented, unrecognized, is the power of community that we have in many African cities, and I must say particularly in Lagos. And this cuts across socioeconomic status. So you had residents' associations rising up to support their less fortunate neighbors. You had community groups, putting up the Veronica buckets so that people could wash their hands. You had people making face masks and distributing to their neighbors. You had school teachers, because of the lockdown, who couldn't go out, mobilizing children in the neighborhood and teaching them, just to ensure that no one is left behind. And what I would like to say, before I stop for others to contribute, is that in looking at the resilience of African cities across all sectors, we must document, the grounded, bottom level resilience and agency that is made manifest. It is not always looking at top-down or systemic measures. Some of these bottom-up micro-scale activities, really make the difference. Thank you.
Thank you very much, Dr. Lawanson. Thank you. Let's pick the thought of Professor Ola Uduku.
Hi, thank you, and thank you for inviting me to this august forum. I think I can really second a lot of what Taibat has just said. Taibat will know that I was actually in Nigeria in, when was it? Was it late January? It was late January. And I was astounded. Flying in from Manchester, United Kingdom, I felt that Lagos was more prepared than the United Kingdom, which actually proportionally is the case. Now, taking a much more, I guess, academic regional approach, and I tend to focus on Africa from the BBC on a regular basis, it was quite clear that actually West Africa, partly because of the Ebola pandemic that had happened before, was particularly well prepared. The contact tracing networks we have in West Africa particularly have been particularly good in terms of tracing infection where it is. We certainly have the problems of every other southern nation in the sense of large populations and economic differences. But the idea about how community gets together and how community has helped to really tide groups through what well, clearly it's a pandemic, it's not even an epidemic, which was the case of Ebola, has meant that the use of social structures and social systems has been critical to, I would say so far, we don't know because it's not yet over, but it has certainly helped to, I would say, moderate the ways in which the pandemic has gone through West Africa at the moment. Obviously, we have the cautionary note. We don't necessarily have all the records of the deaths and so on, but we seem to have been able to be in a better position to deal with both how incomers come through. So in my case, I spent about 1.5 hours at Murtala Mohammed Airport because the public health officials on hand had to scan us all and make sure we put down our information. I walked back to Manchester Airport in the United Kingdom, there was nothing. So I can say already that in some ways we were much more prepared. And also, I think the lessons that had been learned from Ebola is something that certainly the public health network, both in Ghana and Nigeria, that I was actually in January prior to the pandemic, were very much in focus. And again, I would second what Taibat is saying. It is very important that we record this, and this becomes part of our understanding of health systems. And indeed, we spread this education. I think I'll stop here. We have only a minute for each person. Thank you.
Thank you very much. Let's speak the thought of Ephraim.
Thank you for... Hello, and thank you for having me on this program. Yes, this is Ephraim. I'm an associate professor at the Taibat University in Kitwe, Zambia. In response to the question on the responsiveness of African cities pertaining to COVID-19, what we saw in our country, Zambia, was obviously a quick reaction in terms of coming up with the measures like social distancing and masking up and a partial closure. We didn't have a total closure like we saw in other countries, but we did have a partial closure just to have people work from home so that we avoided getting into the offices where we could then have this a very close contact with other colleagues. And of course, the use of sanitizers and washing hands, they were all quickly put in place so that the citizens can be alerted to the effects of the pandemic. We did have at a certain point, obviously, a slip in terms of from the borders. What we saw was that on the South African Botswana side, where we had total closures in those countries, the trucks which were coming from there were obviously limited during that partial closure that we had. But from the eastern side, where we have Tanzania, because Tanzania at the time also was quite open then, we did see a number of infections going up during that period. But of course, there was a quick reaction to see that all traffic that was coming through from that side they were all checked and tested so that we could manage the situation. As a reaction from the universities, also we saw initiatives coming up with automated machines for sanitizing, like my own university, the Copperbelt University, had some prototype, the University of Zambia also, and also the making of sanitizers locally. We saw that going up as a response to combating the effects of COVID-19. Thanks.
Thank you very much, Ephraim. Benny.
Well, thank you very much for inviting me, and I'm particularly grateful to Stephen for the one non-African. In fact, my family is only half non-African. The other half, the better half, as it were, is Ethiopian. So I am a Zungu, as they would say in East Africa. I am interested in the work that you're doing because, to me, there are various issues relating to land, which is the primary concern of all of you, around land ownership, land title, how to hold the rural exodus. But as you were just saying, Chairman, since we're talking about COVID-19, the one point I would like to stress is very simple. We learned from Ebola that the weaknesses of the health services in West Africa were very much at the very ground roots. the nurses, the doctors, the lab technicians. Why? Because they were not in Africa. I'm very sorry. I don't know whether this is just urban legend, but there are more Nigerian doctors in the US than there are in Nigeria. There are more Ethiopian doctors than there are in Ethiopia. And unless you, young Africa, you're all young, much younger than me, unless you start to get a grip on the challenge and say, it's all very well for the North to give aid, to give vaccines, it's all emergency. Long term, Africa contributes a hell of a lot to the health services of the North. So in a period when aid is being reduced, not just by the UK, let us have a little bit of a more in-depth dialogue.
Thank you very much. One thing that has come across from the expositions from Dr. Lawanson, from Professor Uduku, and also from Ephraim, is the role of cities. And I want to pick up on something that Dr. Lawanson, you mentioned, the contribution of the community and the grassroots level. During the pandemic, it was thought of that because African cities are very much informal in the sense that houses are not well planned, and therefore it's an easy spread for the pandemic. To what extent do you think how our spaces were organized also helped these communities to be able to mobilize in helping with how we dealt with the pandemic outside the formal healthcare system? Anyone can pick up on that.
Okay. Yes,
I'll be ready to start while Taibat.
Say that informal communities. Okay.
In my other life, I was actually trained as an architect, and my training is from the University of
Nigeria.
I think the point to be made is that informal settlements have their positives and their negatives. And in the way in which we understand informal settlements, remember that is a coming from the north. What is very important in tropical countries is that you have shelter. That's obviously a basic United Nations right. But the idea that, a house has to have 3 bedrooms and therefore, I guess, what would I say? A house that is not a slum would only accommodate 1 family is not the way in which Africans live and work. Oftentimes, the way we live in our communities, in our villages, is somehow replicated when we talk about informal settlements. This is important because when we think about informal settlement, therefore, particularly in West Africa, the governance structures are very similar to what is happening in the villages. So it's a parallel system to what is happening at a formal level. So you may have in a certain area, the chief who has the titles to the land. The land ownership may not be individual, but the idea about what you do in an informal community still has regulations. And therefore there are power brokers and people who have access to understandings around health systems and so on that have been very helpful. And again, the research from Ebola suggests the same thing. Anthropologically, finding out how burials take place and so on had a very, very strong relationship to how, to stop the spread of things. But from a purely bricks and mortar perspective, as an architect, I think we do have problems with building design. There's no doubt about it. But to a larger extent, we know that for a lot of people, the buildings are secondary to the ability to have residence where you can work, where you can continue your activities. So the idea about, the informal settlement being a place where also there's a parallel economy, an informal economy is critical. And how you can therefore, or what was very critical was that link between making sure that the informal economy and those living in informal areas knew what was required in terms of shielding themselves where possible from the pandemic. And then also, I would say health services that can go right into these informal settlements. You don't have to go to a central hospital 5 miles away if you have primary healthcare facilities that are nearby. So there's, for example, again, in Nigeria that I know well, there had been a polyclinic system that had been in place from the 1960s. You have people like Olufemi Ransom Kuti, the former head of health services back in the 70s. These things were put in place. And I think what seems to have happened, and I'm not on the ground, is that there has been a strengthening of some of those facilities. So there's much more of an integration between the urban and informal settlements, activities, and the health requirements of the spaces that one is in. And of course, with the digitization of tracing and tracking, again, that's, maybe we'll come to that later, the idea about being able to trace people literally by their mobile phones.
Thank you very much. Let's pick the thought of Lawanson. I think you wanted to make a point here.
Yes, I'm ready now. Yes, I did indeed. Well, incidentally, regarding digitalization, because the state government had, predicted that in the case of the cases exacerbating, the health system wouldn't be able to handle it. They had set up they will walk you through, taking care of yourself at home, so that only serious cases needed to come into the hospital. And Professor Ola is correct. The primary healthcare system has been strengthened, particularly in the last 5 or 6 years. And then there's a lot of community advocacy around water and sanitation. And so a lot of the predictions, that went out about how, these informal settlements, people were just going to be dying on the streets, like we heard on the news. It didn't happen. In Lagos, a lot of the cases were in the middle and high income areas, particularly many of those who got infected because they came from international travel. And so perhaps, the herd immunity preceded the people in the informal communities, but they have been able to take care of themselves using indigenous knowledge systems, using herbs, and also particularly, using being their brothers' keepers, where people were able to take communal decisions about care, about survival, and about protecting their community from external harm.
Thank you very much. I have a story I wanted to share on how, for example, housing tenure in a way seemed to have had some impact on the way people have been able to respond to the pandemic. So in Ghana, there's this practice where landlords charge tenants rent advance that amounts to about 2 years, and it's a very topical issue. Currently, the government is considering a policy where the government will set up a fund that will help people to pay this 2 years advance rents, although the legal provision contradicts that, says that landlords are not supposed to charge advance rent for 6 months. So, and the population seemed divided on this subject. But what happened, and from the initial evidence we have gathered so far, in the pandemic, as people started getting laid off from work, we realized that this rental housing market, where people have to pay advance rent for 2 years, actually turned out to be a respite for people who during the pandemic had lost their jobs. So if you had paid your advance rent for 2 years and then you've lost your job, at least you've got 2 years, or probably 1 year. If probably you are 1 year into your tenure, you've got 1 whole year, hopefully, to get something doing or find a new job or something. So if we were to be in a housing market where rents were charged monthly, then when you lose your job and you haven't got any savings to fall on, then you can imagine. So in a way, it started getting us thinking about how our tenure did not necessarily replicate other tenures in other countries. The fact that rent must be paid monthly, because it opened our eyes to realize that this system, to some extent, may have some added advantage. As much as it presents financial stress to the tenants who pay them, in terms of pandemic, it's beginning to show that there's something in there. So how do we now make sure that it's adapted to, one, take away the stress from people, but also make sure that people have that stability in terms of tenure in times where there's uncertainty. So I thought that was quite an interesting thing to also bring to the conversation. Ephraim, we lost you for a while. Do you have any response to the issue around how community or grassroots intervention also made the response to COVID-19 more sustainable? If not, we can move on to the second issue, which we want to speak about, which is urbanization. So, Ephraim, do you want to make a... Sure.
Yeah. Yes. Just a comment on that. My research also is mainly from institutional economics, and particularly a focus on the informal institutional and organizational structures. So my interaction with these places is that they are very organized. While we think that they look disorganized because of the outcomes, the physical manifestation of informal settlements, we see the materials and all that, as Professor Ola mentioned earlier on. But when you go below that, you actually see a very strong local community structure that supports even the development that government could take in those areas. So it is important for the state authorities to recognize those structures, because what we've found is even for the settlements, which we can say they've been legalized from being illegal to a legalized state, they still need to have or to maintain that community level structure in order to have the implementation of government policies. So it is important to recognize that structure, because we actually see that even in the state system, there's an element of informal structures that support the state systems in order for them to work. So I thought I should make that point also before we move on.
All right, thank you very much. Benny, do you want to make a point?
Well, the general point that I would like to make, because I work primarily in the rural areas, is I would like to put a challenge to all of you who are much more expert about urbanization than me, to make a few comments about how you avoid the pull of the cities and the constant rural exodus, which is weakening each African country. Dr. Adesina, the head of the African Development Bank, has made the point recently that in 1980, Africa was not importing any food. In 1920-21, it was importing at the rate of between 20 and $25 billion worth of food. Now, what are the incentives that we can all create, perhaps, to slow down the rate of rural exodus and to re-encourage, invest in the rural areas across the continent? It's a question. I don't have a substantial comment to make.
All right, thank you very much. I think that naturally leads us on to the discussion around urbanization. So perhaps we will get the thoughts of the panel members on this. I think Benny wants us to start by thinking around how do you make sure we deal with the exodus of young people, talented people moving to the city, I'm sure in pursuit of greener pastures. And as a consequence of that, we having to import more food and the city becoming increasingly dependent probably on imports rather than relying on our local on our rural areas. So let's get the thought of our panel members. I think it's a very interesting point.
Yes, I'd like to start by saying that the issues around food production and food security are really not only about people moving to the cities, but they're about the gaps that we have with regards to food production, mechanized agriculture, and food processing. We need to, put some more effort towards that, so that issues of waste of food before it gets to the cities are curtailed. That's one. And number two, you cannot really stop people from moving to the city, because cities are places of opportunities, of aspiration, where dreams indeed do come true. And for the average African young person, moving to the city is a rite of age. So perhaps we need to start to provide infrastructure and opportunities in the rural areas to start to get them to urbanize, in some shape or form. But you cannot stop urbanization. Africa is about to cross the urban threshold. And I think the challenge for us is how to leverage that opportunity. How do we see opportunity in, people moving to the cities? How do we then, create a feedback loop where they are able to, harness the opportunities of the city and still, go back to develop their countryside?
Thank you. Thank you. Professor Ola, you want to respond?
Come in here because half of my lineage is from eastern Nigeria, and everybody knows about Abiriba and Onitsha. In this case, traders actually may live anywhere, but they go back and develop. They've created their own factories in their villages. Now, I think part of the issue actually comes back to food networks and security as well, is that until we have proper transport linkages between the urban and the rural, it is going to be incredibly difficult. The reality is that if you're in Lagos, it's probably cheaper for you to import food from the Americas than to actually even get the groundnuts that we were all taught about in the whatever 70s and 80s, the groundnut pyramid and everything from northern Nigeria. And that is a failure of infrastructural development, because part of again, I'm old enough to remember the telephone network. Originally, telephone networks only went to capital cities in Nigeria. When microwave transmission was developed in the late 80s, it meant that you could telephone without having to go through a PABX exchange. This was very important because as an architect, it would mean that you could actually speak to people on site without having to go through and go slow in Lagos, from Lagos Island to the mainland. We don't have those communication or transport networks to make sure those loops work. So for certain parts of Africa, Benny is absolutely right. We have more than enough food. And why on earth are we depending on having to import from elsewhere? Unless there are very strange subsidies. And then again, the West knows a lot about these subsidies as we go into Brexit in the United Kingdom. But there's an unequal relationship between our food production and indeed our consumption, particularly in urbanized areas. But also, I would agree with Taibat. I think the aspiration to go to the city is not bad, but the point is, do you remember that there are other things? You don't get lost in the city. The city is only one part of a process. The point is that the benefits of the city should actually then go back to one's hometown or the relationships between the rural and the urban. And this can really only be, I think, strengthened by the time we look at having much better transportation links and nexus, particularly for trade and so on. And that's something that, to be honest, the transport networks, particularly for West Africa that I know well, are still very much colonial. And the extraction networks for the railways and so on is very much about the old cash crops. We need to have those networks reinforced and developed if we're going to have, I would say, this balance between the urban and the rural. So,
thank you very much for that insightful point. Ephraim, let me pick your thought on this one. Hello, Ephraim. Okay, I'm sure he will join us. But I couldn't agree more with Professor Ola when you talk about the need for a new transport network. I think that oftentimes the conversation, even around infrastructure, we kind of lose sight of the fact that these infrastructure were built with a certain mindset in place. So just as you mentioned, extractive. And therefore, if we really need to think around new ways to make our transport system more integrated to how our cities are shaping up, then we also need to rethink how we build the transport infrastructure, the kind of transport infrastructure we build, and where they connect to, because we need to know where our food sources is coming from, and be able to build the networks so that the food production center can easily integrate with the consumption center where most of us happily find ourselves. And there are success stories. I think that the conception about the rural and urban, oftentimes we take them to be very static and we don't see the fluidity in them. There are a lot of Ghanaian celebrities now who live in the capital city of Accra and are into farming, massive farming projects in rural areas. But then they're able to do this because they are affluent, they have the trucks, they have the Toyotas that can muddle through the terrible roads. So I can very much relate to the fact that we need new transport infrastructure that can help us to be able to sort of bridge that gap, so that it wouldn't really matter whether you live in the city or you live in the rural area. The ability for these two spaces to interact in a way that is mutually beneficial, I believe would probably help us to get to what Benny is driving at, that we cut down on our importation of food from elsewhere. I don't know whether Ephraim's connection is stable now for him to make a point. Hello, Ephraim.
I think he's still coming through. I would just add to that also integrated regional networks. So it's not just that I am in Nigeria, it's the fact that I should be able to trade across the Francophone countries, from Cameroon right across to Senegal. I mean, it is crazy that the value chain means that it's cheaper to trade with, well, you get more profits from trading with New York or something, or, transatlantically. We're not really looking at our regional networks either.
Thank you very much. Now let's come to another dimension of the urbanization challenge. Obviously, we are all familiar that Africa faces massive infrastructure challenges, and then we see more and more people moving into cities. Obviously, there are opportunities, and I want all of you to reflect on some of these opportunities that Africa's urbanization is presenting us with, and how are we positioning ourselves to be able to leverage these opportunities while also taking in consideration the fact that there are negative externalities that are also happening alongside. The fact that, for example, residential segregation is becoming very popular, access to land is becoming more contested. I want to pick all of you, your thoughts on this. How are we leveraging on urbanization, but also making sure that the concomitant negative externalities are tackled? So let me start with Benny.
Well, to me, as an economist, I'm totally unbiased, of course, as you'll appreciate. As an economist, urbanization poses such an opportunity of creating employment, jobs for young people particularly, jobs that will encourage them to specialize, to become carpenters and builders and roofers and bricklayers and all of those things. And this is where, in a way, African countries have got to move away from World Bank and IMF diktats, that they've got to put big tenders out to big international companies and localize. We see here, even during the worst period of the pandemic, building work was not interrupted because it is the source of continuing income from some of the people in the most fragile jobs. So the tremendous opportunities that are being offered by the urbanization, not just housing, but also, of course, road construction, waterworks, health facilities, schools, we have got to seize this tremendous opportunity, but it must be localized.
Thank you very much, Benny. Dr. Lawanson, do you want to go next?
But I don't think Africa will rise by a multiplication of lower-end jobs. I think the continent will explode by taking advantage of the natural resources for the continent and by leveraging on the knowledge economy. Take, for example, in Lagos, in the last dispensation, we had the whole Lagos program where the state government sought to try to replicate the service model in India, where the India had the basic school certificate, who went through that free program and are now earning foreign exchange because they were able to upskill and are now plugged into the global economy through that skill set. And so, particularly for young people, I think it's important that we leverage on the knowledge economy and we create more entrepreneurial opportunities, more startups, opportunities for startup, opportunities, for people to take advantage of the entrepreneurial bent of the continent. That's one. The second one is, nations don't thrive when there's injustice. And that's another thing that we have noticed, that the urbanization that we're experiencing in Africa today is a skewed urbanization that is increasing socioeconomic inequalities. And so the opportunity to bridge those gaps, I think, will help, to move our cities and our countries in the right direction. If we're able to shift from focusing on the elite, focusing on foreign direct investments, to start looking at what we have and building on what we have, leveraging on what we have and providing opportunities for, the young entrepreneurial ones amongst us to be able to take off, then I will say we are headed in the right direction.
Thank you very much. I particularly agree very strongly with the point on the knowledge economy, which I think that we probably will have some time to talk about when we talk about digitization. Benny, your hands is up.
Yes, I sympathize totally with the previous speaker, but the knowledge economy will exacerbate the difference between the rich and the poor, because just in the rural areas you don't have any connectivity, for example. It might take you an hour to be able to download a page of A4. So it seems to me that you need to attack that at the lowest level, which also generates very cheaply a lot of jobs with a lot of multiplier facilities into the local economy.
All right, Professor, let's hand it up.
Okay. Hang on, I am on. That's great. I think I agree with both groups. I think from again taking on my architectural perspective, the point about what urbanization can do, particularly I would say in the South, is that we have the ability to actually both track back and track forward. As a young architect in Nigeria, the best craftsmen were from Togo, and they had been taught skills that are almost gone now, because they had not gone through, I have to say, a European or a British education system where you're getting your degree certificate was absolutely critical. What they were able to do was to work properly using wood materials and so on. It was a very Germanic system, apparently. I didn't know that at the time. Now, what I think is really interesting in urban areas in Africa is that we don't have to follow, again, the World Bank template. The World Bank gives you a grant. It tells you, right, you've got X acres of land. You're going to set it out this way. The plan has come from America or something. We can actually go back to the ways in which our village structures were built. In fact, we can create a new understanding of what living in the city is. But the point about that is we then use our own locally scaled materials, locally scaled technicians. I mean, people have heard me bang on about it. I do not know why anybody is still having to come to Africa to help us build a school. We have more than enough people at the lower level who can build whatever we need to build, right up to family dwellings. When we get into high density skyscrapers, that may be a different case. But I mean, one of my major issues, and that might be persona non grata, is that, we depend on cement. We depend on things that we're importing and that significantly increase the cost of anything we're doing, whereas we have local materials that are available, and indeed we did have the technology to build in those materials. It's a different lifespan and so on, but then we are all, if we're all engaged or committed to looking at what an African lifestyle might be, and not just Afrofuturism, this is the time to look at this. We already know with climate change and so on, we need to start looking at how we're building. But importantly, we should be able to link in both those with, if you like, lower qualifications who have not gone into the knowledge economy, but also those who have the higher qualifications, the young entrepreneurs, to look at what a future might be in an urbanized network. I mean, I disagree with Benny in the sense that actually the beauty of digitization today is that a GSM satellite will make me, I am able to actually, or my mother is able to phone people in my father's village in eastern Nigeria in an easier way than was ever the case in before phones. And this is just a mobile phone and whatever it is was at. So that technology is going to the rural areas, but it is not properly linked. And the challenge is for us to see what links work and not, I think, I mean, as I think Taibat is alluding to, depending on this trickle-down neoliberal view of development. There are different forms of development, and there's no reason why, as Africans, particularly in urban areas, we can't look at what might be future development.
Very spot on. I think Ephraim is back. Hello, Ephraim. Hello, Ephraim. I think we still haven't recorded. Let's pick some questions from the audience as well. So there's a question here to Benny. Says, I think there's more of a comment. He says we need to devise novel approaches in retaining healthcare workers in Africa and also strengthening the alliance between healthcare workers in the diaspora in Africa. Someone is asking a question: how do we retain the health aspects that Benny talked about? More African health experts working abroad or working in other countries. The question to you is, how do we retain them in Africa? So is there something you want to respond to? Any of you can have a go.
Well, there are certainly very interesting schemes. I think they were run more by the United Nations, where people can do sabbaticals in other countries, particularly